Namaste. Good morning to one and all. परंपरा क्रम के अनुसार हम शांति पाठ से शुरू करेंगे. प्लीज अपने आसन को व्यवस्थित करें. See that your head, neck and spine is aligned. Gently allow the eyes to close. Hands in Namaskar Mudra. Breathing in. Sahana vavatu, Sahanau bhunaktu, Sahaviryam karavavahai, Tejasvinavadhitamastu, Ma vidvishavahai. Om Shanti.
Take your own time and slowly allow your eyes to open. Evidence, Yatharth, Pramana. In the Yoga Sutra, Patanjali describes three kinds of pramana. Pratyakshanumana agamaha pramanani. Direct perception, inference and valid testimony. इस विचार विमर्श का विषय है मानसिक स्वास्थ्य में योग के साक्ष्य आधारित अनुप्रयोग, चुनौतियाँ, संभावनाएं और यथार्थवादी प्रयोग.
It gives me great pleasure to introduce to you an Apta Purusha, Dr. Bir Singh Khalsa ji, who is our plenary speaker for this session on the theme Evidence-Based Application of Yoga in Mental Health, Challenges, Prospects, and Realistic Roadmaps. Today he is joining us live from Boston, and it's, I believe, 11:30 or almost 12 in the night out there. So thank you for taking the time out to be with us now, live. Since you're not here, I would request Dr. M.M. Gore, a close family member of Cavalier Dham, to please accept his felicitation on his behalf. I request Dr. Radhijeshwar Mukherjee ji to please felicitate Dr. Bir Singh Khalsa. Dr. Khalsa is the Director of Yoga Research for the Yoga Alliance and the Kundalini Research Institute, and an Assistant Professor of Medicine at Harvard Medical School. He has conducted scientific yoga research since 2001 on yoga for insomnia, stress, anxiety disorders, and workplace and school settings. He has been a practitioner and instructor of Kundalini Yoga since 1973. He coordinates the annual symposium on yoga research and is the editor-in-chief of the International Journal of Yoga Therapy, as well as the medical editor of the Harvard Report Introduction to Yoga, and the chief editor of the medical textbook, The Principles and Practice of Yoga in Healthcare. Dr. Khalsa is a close associate of Cavalier Dham, and he was supposed to be with us here live. He was supposed to join us and fly in via Amsterdam, but due to the regulations, he could not make it. But it's still with great honor that we receive him again today. We will take questions from the audience after Khalsa ji's presentation. Once again, we request you to pen them down and send them over to us via the volunteers. Over to you, Dr. Khalsa.
Namaste. Thank you very much for that introduction. It's always a pleasure to present at Cavalier Dham. I'm very sorry I'm not able to be there with you in person, but hopefully next time. So the title of my presentation is Evidence-Based Application of Yoga in Mental Health, Challenges, Prospects, and Realistic Roadmaps. And the title of the conference really refers to scope, evidence, and evolution. So there's a lot of words here. And I'm hoping that I can cover some of these words in my presentation: challenges, roadmaps, scope, evidence, and evolution, in the context of my presentation. So in terms of the challenge, I think the whole idea of global mental health is very clear. It is a big burden. This is from the Mental Health Action Plan from the World Health Organization. And the challenge is that taken together, mental, neurological, and substance use disorders exact a high toll, accounting for 13% of the global burden of disease in the year 2004. Depression alone accounts for 4.3% of the global burden of disease and is among the largest single causes of disability worldwide. 11% of all years lived with disability globally, particularly for women. So these are older statistics, and of course, with the pandemic, mental health has suffered even more. Now, in terms of the roadmap of how we bring yoga into society and perhaps address this mental health challenge, we currently have a large population who is practicing yoga on their own. This is being done in ashrams, yoga studios, yoga centers, gyms, and spas. In the US, we have statistics that over 15% of the population has practiced yoga. But if we want to really bring yoga into society's institutions, and we're referring to the healthcare system, the public schools, and the workplaces, this transition really requires research in order for this transition to take place. A healthcare system will not bring any kind of practice or therapy into itself unless there is evidence for research, for safety and efficacy. The same is true in public venues such as our public schools and our workplaces. These institutions will require research to demonstrate that it is safe and that it's worth putting into the curriculum of these societal institutions. Now, of course, this whole idea of the importance of research has long ago been put down by Swami Kaivalyananda himself in essentially what we can call a yoga research roadmap. And a quote from him is that persons that are equipped with an undying faith in spiritual culture and its attainment through yogic practices require no scientific interpretations of these for their progress. But those that take their stand upon reason would be satisfied with nothing short of a scientific explanation of yoga if they are to be induced to take to it. And what we're talking about here is these individuals are basically the policymakers in society, the ones that make the decisions as to what will go into healthcare or the public schools or the workplaces. Another example of where we are is put together by my colleagues at NIMHANS at the Yoga Research Center there. And this paper, authored by Dr. Varambali and Gangadhar, noted that yoga research in psychiatry is fraught with methodological and other practical challenges. Yoga as a therapeutic and evidence-based intervention in psychiatric disorders is promising and merits further attention and research. However, for it to be embraced by the medical and scientific communities, it needs to be backed by methodologically robust evidence for its efficacy and neurobiological underpinnings. So we need not just research on yoga in mental health, we need robust and rigorous research in this area. Now, turning back to this roadmap, this comprehensive mental action plan by the World Health Organization alludes to the need for research. Their action plan objective number 4 is to strengthen information systems, evidence, and research for mental health. One of their cross-cutting principles and approaches is evidence-based practice. Mental health strategies and interventions for treatment, prevention, and promotion need to be based on the scientific evidence and/or best practice, taking cultural considerations into account. And they've actually set a global target. The output of global research on mental health doubles by 2030. So there is a strong emphasis and a recognition of the importance of research to advance our treatment of this challenge to society. Now, an example of an evolution of how this research works. This is often presented as a pyramid of the strength of different types of research evidence. At the bottom, we have anecdotal evidence, and then this can turn into case reports and case series by clinicians and scientists who report evidence. So if we're talking about yoga, we can talk about anecdotal evidence of yoga experiences and then published case reports. The next level of evidence is retrospective surveys. So, for example, surveys have been done on yoga showing that many yoga practitioners report benefit of mental health. And then, of course, there are feasibility trials. These are preliminary trials. Oftentimes, these are just single group trials without a control group, just to demonstrate that that yoga is feasible for mental health and that it has some potential positive benefit. And then the bulk of research really happens at this prospective type of study, the phase 2 randomized controlled trials. This is really the bulk of research. And a lot of these trials will actually be published in journals and picked up by the media. And once the media puts this into their blogs, newspapers, and websites and newscasts, this will then reach the general public. Now, once we have a collection of phase 2 randomized controlled trials, this is then summarized by scientists in review papers and meta-analyses. And these will actually be read to some degree by clinicians themselves, the ones that are on the front lines in healthcare. And these clinicians, having acquired this information through the reviews and meta-analyses, will share this with their patient population. Ultimately, the highest level of research evidence comes through consensus statements and guidelines that are often published by teams of scientists or societies, scientific societies. And then also the publication of so-called phase 3 randomized controlled trials. These are very large randomized trials with multi-site contributions with perhaps hundreds and even thousands of participants to show the practical benefit. And it is through these consensus statements and guidelines that then the medical schools will then incorporate lectures on this topic. So, for example, we will see ultimately the teaching of yoga as a potential therapeutic modality to our medical students. And that, of course, will be future clinicians themselves. And these guidelines, of course, impact the clinicians and they also impact the media. And ultimately, that affects both the patient population and the general public. So this is how we see this sort of evolution of the different types and strengths of research contributing to the implementation of yoga into society as a whole. Now, in terms of the existing research on yoga, this is growing very rapidly. These are statistics taken from PubMed, which is the main citation source for biomedical research. And what you can see here is this is the frequency, the number of publications in every year. And these are citations which have the word meta-analysis or review and the word yoga in the title. So this is a very conservative search, and yet you can see this very dramatic increase. At the beginning of the century, there were very few reviews and meta-analyses, but now we see almost 50 published in 2020. And when we examine in some bibliometric analyses what types of conditions are being evaluated in these research studies, mental health tends to be very strong. And many of these studies are focused on the two major mental health conditions, either depression or anxiety. That's followed by two other major conditions which contribute substantially to morbidity, which is cardiovascular and respiratory conditions. Now, looking specifically at mental health conditions, this is the same analysis on PubMed citations, with the words review or meta-analysis in the title and a mental health term such as depression, anxiety, substance abuse, or stress. And again, you can see a very dramatic increase just over the past 10 years in the frequency of these publications. And so this field is growing very rapidly, which is good because this is this evolution that we're talking about that will take us to having yoga implemented in healthcare and by the general population. When we look at these statistics and break them down in terms of the actual topics, we can see that stress has a large number of publications. And again, this is the word stress in the title and the word yoga in the title. And then that's followed by the two major mental health conditions, depression and anxiety. That's followed by psychosis, particularly studies in schizophrenia, many studies on sleep and insomnia, and the growing body of research on post-traumatic stress disorder, and then finally eating disorder and addictions or substance use disorders. We've also included in our medical textbook, The Principles and Practice of Yoga and Healthcare, chapters on yoga for mental health. We have separate chapters on yoga therapy for depression, on yoga therapy for anxiety, and yoga therapy for other mental health conditions. Now, just to give you a couple of examples of the consensus statements and guidelines, this is from the UK. This is on psychosis and schizophrenia in adults, published in 2014. They noted limited evidence suggests that a yoga intervention is more effective than aerobic physical activity, improving quality of life in the short term. This is from the American Academy of Pediatrics and their guidelines and in a paper on the topic of mind-body therapies in children and youth. They indicated that yoga appears to be a promising complementary therapy for children and adolescents, especially for those with pain and emotional, mental, and behavioral conditions, with very few reported adverse effects. Yoga as a therapeutic intervention has positive effects on psychological functioning, especially in children coping with emotional, mental, and behavioral health problems. And this is a leading organization in the field of pediatrics. In the field of yoga for cancer research, this has been a very strong area of research for yoga, and so it's not surprising that we now see consensus statements and guidelines being published. This is from the American Society for Clinical Oncology in response to guidelines proposed by the Society for Integrative Oncology. And in this published paper in the Journal of Clinical Oncology, one of the leading cancer journals, they indicated that yoga is one of the modalities recommended for anxiety and stress reduction. Yoga is also recommended for depression and mood disorders, and meditation and yoga are recommended to improve quality of life in cancer patients. And another example is here in guidelines with respect to children and adolescents with eating disorders. And in this practice guideline, they indicate that yoga, in addition to standard treatments, may be a reasonable option for medically stable youth with anorexia nervosa, bulimia nervosa, and other specified feeding and eating disorders. And that is a weak recommendation based upon the level of evidence that's been published to date. And one of our speakers at the conference later today, Catherine Cook-Catone, will be addressing her research in this particular area. I want to focus my presentation today on one of the major mental health conditions, and that is anxiety. And anxiety is defined as an unpleasant feeling of worry, concern, or dread. It has physical, emotional, mental, and behavioral components to it. It's not just a thought condition. It has physical components. It can happen with or without psychological stress, and it is actually a normal reaction to a stressor. I mean, anxiety in a healthy situation inspires you and gives you the energy to deal with life challenges. And it has survival value in facilitating resolution of such challenges. However, when anxiety becomes overwhelming and starts to interfere with daily life, it may be clinically significant and be classified as an anxiety disorder. Now, there are a number of anxiety disorders, specific anxiety disorders. These include panic disorder, obsessive compulsive disorder, or OCD, social phobias, which are also classified as social anxiety disorders, specific phobias, and then the most common is generalized anxiety disorder. Now, each of these anxiety disorders has different symptoms, but all symptoms cluster around excessive irrational worry and dread. Now, referring to generalized anxiety disorder, one of the most commonly studied and important anxiety disorders, we have characteristics which really define this disorder. And this is from the DSM-5 characterization of these disorders. This is what determines whether a disorder is clinically significant. And so for generalized anxiety disorder, this means excessive anxiety and worry occurring more days than not for at least 6 months, and about a number of life events or activities. The individual must find it difficult to control the worry, and the anxiety and worry must be associated with 3 or more of the following 6 symptoms, some of them at least present for often for the past 6 months. And this includes restlessness or feeling keyed up or on edge, feeling easily fatigued, cognitive impairment, irritability, muscle tension, and sleep disturbance. The anxiety must be causing clinically significant distress or impairment in social, occupational, or other important areas of functioning. And the anxiety is not explained by another condition or drug of some kind. Now, the lifetime prevalence of GAD, generalized anxiety disorder, is 5.7%, and it's associated with high comorbidity, suffering, and burden. Many patients with generalized anxiety disorder will also experience depression and insomnia, which are very common comorbid conditions. So it is a major mental health condition that deserves our attention. So what is the rationale for yoga for anxiety? And this is a model that really sort of summarizes what we know about the basic mechanisms behind how yoga is working. So when I'm talking about yoga, I'm not just talking about the asanas. I'm also referring to the pranayama, the deep relaxation practices, and very importantly, the meditation component. Now, it's through each of these individually or together in traditional yoga that we improve physical functioning, and I'm calling this box sort of fitness, if you will. And this includes outcomes such as improvements in flexibility, strength, coordination and balance, respiratory function, which leads to an overall physical self-efficacy, which through the mind-body connection leads to a mental self-efficacy. Now, each one of these components of yoga, either alone or together in traditional yoga, improves self-regulation of internal state. And the most important self-regulatory phenomenon includes stress regulation, improving stress tolerance and resilience, and emotion regulation. And so this leads to these behavioral states of enhanced resilience and tolerance, improved equanimity in the face of the ups and downs of emotions day to day. And this leads to an overall self-efficacy of functioning mentally. Now, it's largely through the meditative component, through the focus of attention and the act of meditation, that we increase mind-body awareness, also been referred to as mindfulness. And through the engagement of the attention networks, we're improving our concentration, our cognition, and ultimately this leads to a state we refer to as metacognition, the realization that we are not our thoughts, that we have the ability to self-regulate our thought processes. And if you will, it can be considered that Patanjali's Yoga Sutras are really an essay on the topic of metacognition. Now, interestingly, metacognition is the principle that underlies the most powerful and universally used form of psychotherapy today, which is called cognitive behavioral therapy. And so yoga shares with that very powerful technique this concept of metacognition. And then finally, through the meditative component primarily, we see over the longer term typically the experience of these deep unitive states, experiences of transcendence, the flow state, which leads many people to a deep transformation and a change in life meaning and purpose. And although this takes longer and more regular practice, nevertheless, this can be very powerful for patients with anxiety type disorders. And I'm calling this box pure spirituality. Now, the one thing you can see from this model is that we're addressing the human from a wide spectrum of functions, from the gross level of connective tissue and muscle to the deepest experiences that humans can have. And as a consequence, we see changes in global human functionality, in physical and mental health and performance, stress and emotion regulation, improvements in mind-body awareness and mindfulness, and ultimately the establishment of this state of metacognition. And at a deeper level, in terms of positive psychology, we can see ultimately improvements in positive behavior, well-being, values, life purpose and meaning, and even spirituality. And from this logic model, it's very clear to see the relevance of this to something like anxiety disorders, the self-regulation of stress and emotion, and the improvements in mindfulness and metacognition are at the core of the issues that underlie anxiety disorders. And yet the physical component is also very important. And that is highlighted by the physical symptoms that are listed under generalized anxiety disorder. Patients have increased physical stress response symptoms. They have sleep disturbance and a number of physical symptoms, including fatigue, headaches, muscle tension and aches, difficulty swallowing, trembling, twitching, irritability, sweating, nausea, lightheadedness, breathlessness, and hot flashes. And different patients will experience different levels of these types of physical symptoms. And so really what we're talking about in many mental health conditions, including generalized anxiety disorder, is that these are not strictly mental or thought conditions. These are mind-body disorders. And so it makes sense to treat mind-body conditions with a mind-body intervention. And yoga is exactly such a mind-body intervention. It includes the asanas, it includes the pranayama. And these are very important components of yoga that contribute, I think, substantially to the potential benefit of yoga for mental health conditions. The same is true for other mental health conditions such as post-traumatic stress disorder and even depression. Now, looking at the use of yoga for anxiety in the general population, it is being used by individuals in the general population to help with anxiety, and this appears in media articles. This is from a well-known Western news magazine, Newsweek, Coping with Anxiety. Science shows that meditation, massage, yoga, even laughter can change bad habits in the brain. The whole idea that yoga has some efficacy for anxiety. In fact, there are now a number of books that have been published, this one on yoga for anxiety, this one on yoga therapy for anxiety. This is a more recent book. This is combining yoga with cognitive behavioral therapy for anxiety by my colleague Manjit Kaur Khalsa. And then we see that the research evidence starts to get into other publications. This is actually by Harvard Medical School. This is a special health report entitled An Introduction to Yoga. And in this book is a summary of all of the research evidence that has been done, plus recommendations for how individuals can engage in a yoga practice. And within this book, of course, is a description of some of the evidence that's been published on yoga for anxiety. And if you go onto the Harvard Health Publishing website, you will see articles on yoga and the science. And so this particular article on yoga for anxiety and depression. Research suggests that this practice modulates the stress response. And so this kind of public promotion of yoga and the research on yoga can affect the general population directly. We also see that many different yoga sites will include information on yoga for anxiety. So this is the well-known Yoga Journal, a very popular magazine read by yoga practitioners. And if you go onto their pages, you'll find a whole slew of articles and asanas and practices that are recommended on yoga for anxiety. So now let's turn our attention to the research on yoga for anxiety. What is the evidence that we are now starting to have for this? And the evidence again follows this trend from this is sort of the weaker research to the stronger research. So this is a survey study, a retrospective survey study that compares yoga practitioners with non-yoga practitioners. And they were looking at scores on the profile of mood states. And what you can see is that in the long-term yoga group practice, the scores of mood disturbance is much less than in the control group that did not practice yoga. But when you look specifically at the scores on anxiety, there's statistically significant difference that the yoga practitioners are reporting less anxiety than those that do not practice yoga. This is from a survey in Australia. and looking at a survey of yoga practitioners. While 58.4% of respondents gave reduced stress or anxiety as a reason for starting, 79.4% found this to be a reason for continuing. So despite the fact that only 58% started because of stress and anxiety, 80% actually, after practicing yoga, found this to be a strong reason for continuing the yoga practice. Of those who reported using yoga for a specific health or medical condition, more people used yoga to address stress management and anxiety than for back, neck, or shoulder problems, suggesting that mental health may be the primary health-related motivation. Again, this is preliminary supporting evidence of the role of yoga for mental health and anxiety. And again, this most recent publication by Tina Cartwright at Westminster University in London, published last year, looked at the perceived helpfulness of a number of different issues. And what you can see is that stress leads this. 98.4% of yoga practitioners found yoga to be helpful for stress. This is followed by anxiety itself at 96.8%, and then by depression, 93.2% found this helpful. And then high scores for sleep issues as well. Now, the summaries of the research in terms of the review papers and systematic reviews. This is a review that was published early on, concluding that nearly all studies indicated reduced anxiety after a yoga intervention. And this was looking at studies involving yoga for children and adolescents. This was published in 2015. This is in 2016 by my colleague Stefan Hoffman, looking at the effect of Hatha Yoga on anxiety. This was a meta-analysis. Their conclusion was that Hatha Yoga is a promising method for treating anxiety. And then more recently, Holger Kramer, based in Germany, published this systematic review and meta-analysis of RCTs on yoga for anxiety. And this is the forest plot. Everything that's shown to the left of this vertical zero line shows that the intervention, the yoga intervention, was favored over the control intervention, showing positive efficacy of yoga for anxiety. Now, looking at individual studies that have been done, this is a preliminary trial. This is this phase 1 type of trial, a single group trial that was looked at specifically. This was conducted in Toronto in Canada. And they looked at a yoga intervention for patients with generalized anxiety disorder. And what you can see is statistically significant improvements on 2 key anxiety measures on the Hamilton Anxiety Scale, on the Beck Anxiety Inventory, showing statistically significant improvements on the Hamilton, which is the gold standard outcome measure, and a strong trend for the Beck Anxiety Inventory. This is a more recent trial just published last year by my colleague Suzanne Danhauer and her colleagues. And what they looked at here was a comparison of yoga versus cognitive behavioral therapy. Again, this very powerful form of psychotherapy. And what they looked at was anxiety in the elderly. They looked at scores of worry and scores of anxiety. And what you can see is that the scores, the change from baseline, is very similar between cognitive behavioral therapy or CBT and yoga for both worry and for anxiety, suggesting that yoga is working just as well as the premier form of behavioral treatment for anxiety in the elderly. And then our colleagues at NIMHANS, who are presenters at this conference, Drs. Varambali and Gangadhar, are developing a module of yoga for the treatment of anxiety, and this is their publication this year, looking at a preliminary single group trial showing reductions in the Hamilton Anxiety Rating after 10 sessions, and then 4 weeks later, maintenance of the improvements that they've seen, and then also another measure of generalized anxiety disorder showing reductions. And that's also associated with some improvements in sleep and self-efficacy, holistic health, and disability. Now, I want to sort of finish off this sort of discussion with an example of the evolution of research on yoga for anxiety. And the example I'm going to use is the work that's been done in my laboratory with respect to anxiety and anxiety disorders. Our first work with anxiety happened with a relationship that was developed with the Kripalu Center for Yoga and Health in Western Massachusetts, which is the largest yoga center in the United States. And they are very close to a major well-known music institute called the Tanglewood Music Center. And our focus here was to try and see if we could improve music performance with yoga practice. Well, what we found was that the issue that was very important for musicians is performance anxiety or stage fright. If musicians cannot deal with performance anxiety, their career is at stake. And we found through our research with these young adult musicians that solo music performance anxiety was reduced. This is the black bar, the yoga intervention. Music performance anxiety and the solo performance condition was reduced compared to a control group that did not practice yoga, suggesting that yoga has this direct effect on what is essentially a form of social anxiety disorder. We followed this up with a study in adolescents that were working at this Music Institute. And again, we found that solo music performance anxiety had a significant reduction after the 6-week yoga intervention, whereas the control group that did not practice yoga did not have similar kinds of improvements. There's actually a questionnaire called the Music Performance Anxiety Inventory for Adolescents. On the total scores, we can see the yoga group showing a nice statistically significant reduction. And in terms of somative and cognitive impairment, we can see the yoga group showing improvement. And then in terms of performance itself, we can see the yoga group showing an improvement as well. Now, unfortunately, we tried to get grants to continue this work, to continue the funding for this work of a form of social anxiety disorder, but we were unsuccessful in getting funding for this. So this is another challenge that we face in the field of research on yoga for mental health conditions. We were funded for a trial of yoga for post-traumatic stress disorder, and this was actually through the Department of Defense in the United States because the prevalence of PTSD in former servicemen is very high. And this was a study actually done in Canada in the general population. Not only did we show improvements in post-traumatic stress disorder, but the scores of anxiety themselves was reduced. This is the yoga group here in the black bar showing reduction at mid-treatment and at post-treatment compared to the control group, which did not have equivalent reductions in anxiety. We've also done studies in yoga in public school settings and looked at a number of mental health characteristics. And one of the mental health characteristics we see by offering yoga to children in schools is an improvement in anxiety itself. And here's the anxiety scores. You can see the anxiety scores showing an improvement in the yoga group, but a remarkable deterioration in the control group. And this is actually endemic of what's happening in our schools. Our schools are seeing this deterioration, this worsening of mental health characteristics across the semester. And yoga is acting as preventive medicine in preventing this decline in mental health. And anxiety tends to be one thing that is really notable. In fact, we can even look at the qualitative studies we've done with a lot of these public school students. And the quotes really indicate their perceived benefit with respect to yoga for things like anxiety and stress. One student said, if you had a lot of stuff on your mind or something, you could just use some of those exercises. I just felt calmer and stuff. Another student said, I used breathing outside the classroom in my life to calm me down. If I was stressed or angry, I would then do the breathing to calm me down, and I will probably continue to do this. I was less anxious about school in general. Another student said, before you're taking a test, relax and breathe, and you don't get as nervous or as tense. And exam anxiety is a major source of anxiety for students in school settings. Another student said, I felt it was easier to calm myself if I was nervous about something or just liked to deal with my stress. So clearly you can hear this in the experiences of the children in these studies. And we were able to get funding for one trial of yoga in a school setting. However, we were unable to get continued funding. And again, this again is a recurring challenge in the field of yoga research in general, that it is difficult and challenging to get funding to conduct the research. We've also done studies on Kripalu yoga intervention in the workplace setting. This was a study we actually did in Harvard physicians. This was done at Brigham and Women's Hospital in physicians in the field of obstetrics and gynecology. And what we were looking at was burnout, which we showed positive benefit for. We saw reductions. This was a single group trial, reductions in burnout scores that were maintained at long-term follow-up. This was a 6-week yoga intervention delivered at the hospital. What we also saw was, at least at the post, a reduction in anxiety. So yoga, again, showing this change in anxiety. We also did a study in Harvard medical residents. This was a randomized controlled trial. Again, we saw improvements in total burnout scores that were maintained at the long-term follow-up, but also reductions in anxiety in the yoga group. Now, we were fortunate enough to actually develop a relationship with 2 psychologists, clinical psychologists, who were actually yoga teachers and implementing yoga with their patient populations. And in collaboration with them, we did a study. And in this case, this study combined a Kundalini yoga practice together with cognitive behavioral therapy for generalized anxiety disorder patients. And we were able to get this paper published. We showed statistically and clinically significant improvements in state and trait anxiety and even scores of panic. And working with another clinical psychologist who was using just a Kundalini yoga intervention for her patient population, we were also able to show improvements in a number of measures of generalized anxiety disorder. Now, we were able to take this pilot data and submit a grant application to the National Center for Complementary and Integrative Health in the US, and we were very fortunate to get funded for that trial. And it's when you get funding that you are able to carry out these higher level research studies. And so this was the trial that we proposed and conducted and were funded for. This was the aim, was the efficacy of Kundalini Yoga as taught by Yogi Bhajan. The comparison groups in this trial was a 3-arm trial, was cognitive behavioral therapy and a stress education control condition. And we were, the goal was to compare Kundalini Yoga and cognitive behavioral therapy in a non-inferiority test, and both of these compared to stress education in superiority tests. The plan was to enroll 230 patients with a primary DSM-5 diagnosis of generalized anxiety disorder. This was a multi-site randomized controlled trial conducted at Boston University and Massachusetts General Hospital, Harvard Medical School. We were to recruit 95 cognitive behavioral therapy and Kundalini Yoga patients and 40 stress education patients. The intervention included 2 instructors in a group format over 12 weekly 2-hour sessions. In addition, participants were to do a daily homework practice of 20 minutes. There was intensive treatment integrity and compliance monitoring throughout this trial. The outcomes were evaluated bi-weekly at end treatment and at 6-month follow-up. We had quite a few number of outcome measures in this very strong research design. And we also included a number of secondary aims and analyses, including things like mediators, moderators, and an evaluation of mechanism. And this work is still ongoing. Now, we were very fortunate to have success with this trial, and actually great success in publishing this in a major medical journal in JAMA Psychiatry, the Journal of the American Medical Association. And what you can see here is the outcomes of this trial. We successfully randomized 226 patients, 93 to yoga, 90 to CBT, and 43 to stress education. Ultimately, we had 93, 90, and 43 included in the analysis. The Kundalini Yoga was the style as taught by Yogi Bhajan. It's a popular style in the US, Europe, and South America. The daily home practice included, or the weekly sessions included discussion on compliance. The home practice session was practiced. There was discussion of philosophy and psychology, 15-minute pranayama practice, a full yoga set practice of 50 minutes, and a breathing meditation of 15 minutes for the 2-hour session. In addition, patients were to practice at home every day a 20-minute home yoga practice with an audio guide. The cognitive behavioral therapy was a standardized protocol with former treatment modules, cognitive restructuring, and all the other elements of conventional CBT. And the stress education condition was education on stress response, but no active mind-body techniques. And again, all 3 treatments had a 20-minute home practice. The yoga practice included simple loosening exercises, some spine flexes, shoulder shrugs, neck rolls, and the main intervention was an 11-minute practice of a segmented breath for anxiety, focusing on the exhale, which is known to be a ratio that induces the parasympathetic nervous system. This is the outcome that we experienced. This is the response rate. This is the rate of success of treatment. And what you can see is that the Kundalini Yoga intervention is in the orange line, cognitive behavioral therapy in the blue, and stress education in the black. And cognitive behavioral therapy and stress education and cognitive behavioral therapy and Kundalini Yoga were superior to stress education at the 12-week end of treatment. Only the CBT was effective at the long term. And what you can see in comparison of Kundalini Yoga with CBT, the gold standard, is that after 6 weeks, virtually they are neck and neck. But clearly CBT remains to be the superior, but we are very encouraged by these results. This is the first rigorous trial of a yoga intervention for generalized anxiety disorder, and yet we're seeing a very strong clinical response. And so we are very encouraged by this evidence. This is the first trial, and of course, cognitive behavioral therapy has been optimized over many decades of implementation. So the fact that a yoga intervention could have this much efficacy compared to CBT is very encouraging. And future research could perhaps put together a yoga plus CBT intervention to enhance outcomes. The other virtue of a yoga intervention is that cognitive behavioral therapy is not as widely available as yoga. So this really supports this whole idea. Now, moving to this idea of the importance of this, the fact that this was published in a very strong journal has a lot of impact. There is a metric by a company called Altimetric, which does a sort of an evaluation of different research studies and talking about the impact of how this research study has efficacy. It looks at whether this paper was referred to in news outlets, in blogs, was tweeted, or was on Facebook pages. And what you can see is that they come out with a score. This is the score for this particular paper in this strong journal, 823. And interestingly, this paper fell within the top 5% of all research output, has the greatest impact on society, and this is mediated through impact on the general population as well as through the healthcare system to clinicians, ultimately to patients. So this is really a summary of how we can see this roadmap fleshing out of bringing yoga into healthcare and into the general population. So I acknowledge all of the researchers, the many researchers that contributed to our major randomized controlled trial for generalized anxiety disorder, particularly Naomi Simon and Stefan Hoffman, and the many researchers who looked at our early research on music performance anxiety, post-traumatic stress disorder, and yoga in schools and yoga in the workplace. I also acknowledge the support of the National Center for Complementary and Integrative Health in supporting our randomized controlled trial. This was a $4 million trial that was supported by our federal government. And then Kripalu Yoga Center, which supported a lot of the research that was done on PTSD, on yoga in schools, as well as the yoga in the workplace. I also work closely with the International Association of Yoga Therapists promoting yoga therapy. I serve as the editor-in-chief of the International Journal of Yoga Therapy, and the whole idea of this organization is to really promote the implementation of yoga into healthcare. And then I also serve as the director of yoga research for the Yoga Alliance, one of the largest yoga associations in the world. My role there is yoga research literacy. We have many yoga research videos, webinars, and a collection of citations for the general population and for yoga teachers and yoga practitioners. And then I also serve as the director of research for the Kundalini Research Institute, which supports the style of yoga that I practice. And I close with a favorite image. This is semi-precious stone of a yogi embedded in the Golden Temple in Amritsar. So I thank you for your attention, and I look forward to your questions.
convincing presentation and for bringing to our awareness the scope for medical practitioners to integrate yoga therapy into their clinical practices.
We now take a few questions from the audience. If you have any questions, could you please send them over to us, then we can ask them. We also have another question ready. So, is there evidence for different meditation techniques like transcendental meditation, Kundalini Yoga, etc., for specific mental disorders like anxiety? And how do we know which one to choose?
Study to show efficacy for many mental health conditions. They've had particularly strong evidence for a program called mindfulness-based cognitive therapy, which has been shown to actually improve relapse to depression for major depressive disorder. So there's a whole parallel body of evidence that really supports the research on yoga, of course, because yoga incorporates meditation. But of course, I did not include that in this lecture. But you could easily give multiple lectures on the evidence for meditation practices. In terms of which to practice for which type of disorder, we don't have that specificity yet. I mean, the yoga research is not at that level where we can say that this type of yoga is better than that type of yoga. All we can say in general is that a yoga that incorporates more of the traditional components of yoga is more likely to be efficacious. In other words, if you're practicing a yoga style that is just asanas, but no pranayama, no meditation, no relaxation, it is likely that you're going to have less efficacy. But if you practice a traditional form of yoga that incorporates all of those components, you are more likely to have clinical efficacy.
I have a question. I would like to know if the person's diet as well as adverse childhood experiences also contribute to anxiety at a later age.
That is certainly the case, and the whole thing of adverse childhood experiences, or ACEs, is becoming a topic of very strong research, and certainly patients with evidence of trauma, anxiety is one of the experiences that people have. And so certainly that is there. Not everyone with generalized anxiety disorder has the same history or the same types of symptoms. And this is something that research in mental health is going to have to deal with eventually, is this whole idea that not all generalized anxiety disorder patients are the same. Some I was muted, sorry. Sorry. So in terms of the approach of yoga to different types of conditions, different kinds of conditions have different experiences in different patients. And yoga therapists have a criticism of a lot of the yoga research. They say that you're using these research modules that are one size fits all. Whereas in yoga therapy, the yoga therapist treats the patient specifically and directly and addresses specific issues that that patient may have. And we know that different forms of disorder, although someone can be classified as having generalized anxiety disorder, different patients will experience this with different symptoms. And that suggests different types of relationships and different types of etiology to their disorder. And so a yoga therapist who can tune into the patient and give that patient specific practices that can target that person's specific vulnerabilities or symptoms may be more effective than a one-size sort of fits-all module type of treatment. So this is something that is another evolution that we need to look into to really try and identify what specific practices are best for specific patients and for specific disorders. So this is something that we need to move towards.
Thank you, sir. We'll take one last question related to performance anxiety with sports persons. How can we deal with the anxiety of a sports person?
Again, performance anxiety is common to everyone. It's common to everyone that gives a lecture. It's common to anyone that performs to the public. And it's the same phenomenon, whether you're talking about music performance or sports performance. There are actually a few studies examining the efficacy of yoga psychologically in sports performance, as well as in terms of the accuracy of sports performance itself. Anxiety in sports performance is critical, especially when you're talking about high-level sports performance. If you're talking about, for example, national teams that are in major leagues, we're now talking about an accuracy of performance that requires millimeter resolution. A millimeter is the difference between scoring in a sport as compared to failing in a sport. And an experience of anxiety and anxious thought at such a time can be really catastrophic in terms of one's sports performance. So I think yoga has a very strong place. And in fact, if you look at many of the sports teams in the United States, these teams are involved in multi-million dollar ventures. And so many of the sports have yoga classes offered to the athletes to enhance not only their physical performance, but also their mental performance, their mental anxiety. And then yoga also has benefit for sports performance in terms of prevention of injury, because the stretching and the flexibility and the sense of interoception, the sense of motion and the sense of the perception of one's body in space allows one to move more in a more informed, more mindful way, which is less likely to yield an injury. And of course, injury in major sports is huge. If you have the star of your team has an injury, your team is not going to do as well. And so yoga has many benefits for sports performance, and this is an area that also can be very informative for the general population to see that if an athlete is using yoga to enhance their performance and functioning, it makes sense that the general population could also have the same benefits.
It's a great learning experience to hear from you. And I'll repeat Rima Dada's words, and great impetus to guide our research as well. So we look forward to for you to join us again this afternoon for the scientific session. And before we close this session, we just have an announcement to make.
We now have a short tea break at the Patanjali Circle, and we expect you to be back at your seats by 10:55 for the second panel discussion, which will be moderated by Dr. Ganesh Rao on the topic, The Ancient Yoga Sutra and the Modern Psychological Science, Possibilities for a Synthesis. Thank you.